Hello, I have a lecture on selective spinal immobilisation. So there are two tools that we use to guide us with selective spinal immobilisation. One of them is the NEXUS rule. The NEXUS stands for National Emergency X Radiography Utilisation Study. And the NEXUS study was a large study which was aimed at providing an evidence-based tool for paramedics and emergency department staff to decide whether a patient needed their C-spine x-rayed. And they found that if patients meet all 5 of the criteria in the rule, then they don't need x-rays. And that's been extrapolated into pre-hospital care as to mean that they don't require immobilisation. So the rules are the patient must have no posterior midline cervical spine tenderness. Now, all that means is you run your fingers down the back of their neck and give all their vertebrae a good hard, push and poke. And if they're not complaining of pain when you do that, that's good. No evidence of intoxication. So that doesn't mean the person's had 1 or 2 beers. That means they're intoxicated to the point where they could potentially not realize they have a vertebral or spinal injury. A normal level of alertness. So this automatically rules out our, dementia patients. They need to have no focal neurological deficit. So even if you, feel their neck, feel their back, and there's no pain, but their fingers or their toes have some loss of sensation, or they feel weak, that's a potential neurological deficit. And no painful distracting injury. So again, this isn't, a graze on the knee. This is an injury that's so painful, it could potentially make them not realize they have a vertebral fracture. So we're talking, long bone fractures, very large lacerations, that sort of thing, okay? Now, if all 5 of these criteria are met, you don't need to do any spinal interventions, so no collaring, certainly no rigid immobilisation, regardless of the mechanism of injury. Now, that's significant because until this rule and the other rule that I'll show you had become validated, if someone was in a high-speed crash and so let's say the car has rolled at 100 kilometers an hour, they would have been completely immobilized. Whereas now, despite that mechanism, if this person has none of, can fulfill all 5 of these criteria, then we don't need to do anything with their spine. Now, this is the other rule, the Canadian C-spine rule. So as you can see, this one's a little bit more complex. So, and there's some double negatives, but we'll just run through it. So from the top, are there any high risk factors which mandate radiography? So in this one, any patient who's over 65 and has had that mechanism I gave before, like a car rollover, they would get collared and they would get an X-ray. But if they're not over 65 and they haven't had this dangerous mechanism, we move down to the next section. So are there any low risk factors which allow safe assessment of their range of motion? So this is the big one for us is probably that third one down here. Have they been ambulatory at any time? So if a person is complaining of some, neck pain, but they have been walking around, moving their head before you got there, that's someone who wouldn't need to be collared and wouldn't need an X-ray. Now, if they've met that criteria, so someone who at a car crash, for example, goes, oh, I do have a bit of pain in my neck. They've been walking around, and you say, look, are you able to rotate your neck left and right? And if they can do this without it causing them increased pain, again, they don't need to be collared. And you can see that all that takes you down to the path to no radiography. You can see up the top that the rule is not applicable in lots of cases too. And this is, again, one of the things that has added to its complexity, the combination of double negatives. So if they don't have this, then they need to do something. And the fact that it's not applicable in a large amount of cases. So which is better? Both of the rules work. They both have a high specificity and sensitivity for ruling out and safely ruling out a person who can avoid a neck X-ray. The Canadian C-spine is slightly more sensitive than Nexus, but this is offset by the fact that it's more complex to apply. Now, the Queensland Ambulance Service uses Nexus because it is easier to apply. It's easy to remember. You don't need a little card with you to work through the flow chart. You can actually just do it in your head. The introduction of soft collars into the Queensland Ambulance Service and coming in around the country too has rendered this need for selective spinal mobilisation somewhat moot. Now there are still plenty of people who will have some neck pain, but as per say the Canadian C-spine rule, if it's been delayed onset neck pain, for example, would not need to be collared. A lot of the time, paramedics will just collar these people anyway because the soft collar is so easy to use. It doesn't cause patient pain. It doesn't cause any of the problems that the rigid collar and the rigid immobilization used to use. That there is a fairly good argument for just popping a soft collar on anyone who you think even might have a vertebral or spinal cord fracture.